When you come to the CV unit, we will have a room prepared for you that is pretty big and pretty bright. Lots of lights on, a big bed in the middle.
There's going to be a lot going on in the room, lots of equipment, but your nurse is going to walk you through every step of what's going on and involve you in every place they can.
When families first arrive, I always like to, as a charge nurse, introduce myself and kind of point out who the team members are so they know who exactly is touching their child and why.
You'll get to meet a whole bunch of people. There's a bunch of respiratory therapists, pharmacists, the doctors, nurse practitioners, of course.
We like to teach parents and families about what's going on because there's a lot of really complex technological things, and we like to answer questions and we like to teach.
The people that are taking care of your child have that child's best interest at heart. We want to see them get better, and we want to see them get better as fast as they can.
Rounding is where we will stop by the bed space and we review all of the numbers of the vital signs for your child, as well as all of the lab work and the imaging studies done. And that happens about twice a day, once in the morning and once in the afternoon.
Parents are invited to be part of those rounds. We call that patient-centered rounds. We want them to be able to contribute their observations for how their child is doing and to be able to understand what the plan is for the day.
Things will be transparent and they'll be aware of what's happening, whether they're present or not.
We know that this is a scary time for you. We know that having a sick child is not easy. So we're here to be your allies.
Patients and families can expect that this is what we do every day. So while this is one of the biggest anxiety-provoking days of their lives, this is our everyday. So we are experts. We have experience in taking care of these kids, and they're in really good hands.
They might also be seeing some of our interdisciplinary teams, such as child family life, social work, occupational therapy, physical therapy, speech language, all sorts. We have a wide variety of care team members to provide the best care for the patients.
Don't be afraid to ask questions. You're trusting us with your most important, precious family member. You are not bothering us by speaking up and saying that you don't understand something or have questions about things.
You know your child better than any of us, and you will always know your child better than any of us. And you can be your child's best advocate. Sometimes it's the little things like saying they like to go to sleep with their purple blanket. That can make all the difference in the world for the nurse who goes, I have no idea why this child's been crying, but now we've figured it out.
This is a marathon, not a sprint. So take the steps forward as they are, and understand that every now and then there may be a few steps backwards, but that doesn't mean that we're not constantly working towards bettering your child's health.
Celebrate the little victories that happen, no matter how big or how small things are.
We are going to do everything that we possibly can to make their stay as enjoyable as we can possibly make it, and make it as fast as we can so we can get you home to where you really want to be.